you. Thank you. Thank you so much. Thank you all for being here. Familiar faces, new faces. Thank you, Gordon. Thank you, Hannah. Thank you all for wanting to be here to keep talking about this vital subject. We're trying to get our hands around it. Hasn't been easy. We've been talking about this for years now. Things are turning. Things are turning. I want to thank our hosts, too, Central Maine Community College and President Libby, as well as President of Community College System, Dave Dagler, who is here somewhere. There he is, right there. And Auburn's Mayor, Jeff Harmon. Thank you for being here as well, hosting us. We're also privileged to have Dr. Miriam Delphin-Rittman as our keynote speaker of SAMHSA. I also want to thank the many members of my staff, other members of my staff, including Sarah Squirrel, for convening this summit. The opioid epidemic is still reaching into every corner of our state, but something important has changed these past 6 years. To some extent, the shame and stigma that too often leave people alone and isolated to agonize about how to help their loved ones, that's gotten smaller each time we have come together to talk honestly about addiction and its aftermath. 5.5 years ago, I set 4 clear goals for our response to the opioid epidemic. At the time, I designated Gordon Smith as the Director of Opioid Response, or DOOR, as it were. I issued an executive order that laid out these responses: purchasing and distributing more naloxone, increasing access to Suboxone in hospital emergency departments, recruiting and training recovery coaches, and fourthly, making medication for substance use disorder accessible universally, especially in Maine's prisons and jails. Our partnerships between state and local government, nonprofit organizations, healthcare providers, individuals with substance use disorder, and their family members, and many other people who are participating in this summit today. Our partnerships are achieving real progress on those goals and others. Don't give up. Last year, drug overdose deaths declined by 16% in Maine. The first time in 5 years that we've recorded an annual decrease. In fact, we were just one of just 4 states, along with Nebraska, Kansas, and Indiana, to experience a decline of more than 15%, while other states like Alaska, Washington, and Oregon had increases of overdose deaths of nearly 30%. This year, we're continuing to make progress. From January to June, fatal overdoses have decreased by nearly 12% so far. When you consider the preliminary numbers from July so far, we're on track to record a nearly 15% decrease for the first 7 months of 2024 over the first 7 months of last year. It's possible that the decline in opioid prescriptions is contributing to the decline in overdose deaths. I think there's a connection. In the past 5.5 years, we've enhanced the prescription monitoring program to prevent overprescribing and diversion of prescribed opioids. We've required all Maine providers who are actively prescribing controlled substances to be reviewed every 6 months. We've deployed a clear process for reporting prescribers who are overprescribing to their medical boards. We've created additional training for prescribers whose practices may put patients at higher risk. The number of Maine patients receiving high-dose opioid prescriptions has gone from nearly 4,000 in 2018 to 1,869 in 2023, so more than half. Fewer people are taking prescribed opioids, and that fact alone may be contributing to the decline in fatal overdoses. Fewer people getting addicted in the first place. We all know about that continuum. So that's welcome news. But we're not complacent. Traffickers are adapting every day to avoid efforts by law enforcement to stem the tide of drugs into Maine. People seeking a cure for pain, an anesthetic for experiences that are just too heavy to carry. They're finding even more potent and deadly substances, things that can worsen existing mental health challenges or set off new mental health disorders. One recovery coach named Jillian likened her own recovery from substance use disorder to walking in a field of tall grass. Walk through it enough, you've made a path, and it's easy to keep walking down that path instead of finding a new direction. For decades, states across the country, including Maine, walked down the same well-trodden but failed path. Overwhelmed by a flood of legal and illegal drugs that change a person's very brain chemistry, too many policy leaders, nevertheless, blamed those same people for making bad choices. We recognize that while accountability is important, addiction is a disease of the brain, not simply a choice. We're going in a new direction, step by step. My administration is doing all we can in a responsible and reasonable manner to stop drugs from reaching Maine, to prevent substance use disorder at an early age, to treat it when we can't prevent it, and to set people on a lifelong path to recovery, above all else, to save lives. As a grandmother to 5 youngsters here in Maine, I personally want to do everything I can to keep them and other youngsters from starting down what can be at times an all too easy path of addiction. That's why a partnership between CDC and Maine CDC and public health organizations called the Maine Prevention Network puts substance use prevention programs in 78 middle schools last year. Let's make sure we get into every school now with serious and effective prevention programs. One of those schools was Skowhegan Area Middle School. There's somebody from Skowhegan. Somerset Public Health taught 400 Skowhegan Area Middle School students their risk module to help them identify different types of risks in different situations and discuss with their peers why certain risks feel healthy or unhealthy. And the Children's Behavioral Health Services at the Maine Department of Health and Human Services is working with Healthy Acadia to launch a youth recovery coaching pilot program. That pilot program in Washington and Hancock counties will train 1 youth peer recovery coach coordinator, 2 full-time youth peer recovery coaches, and 2 youth peer recovery coach interns to sound the alarm on the danger of drugs. This has got to be an effort of young people talking with young people, peer-to-peer, to be effective. As Kylie, a 14-year-old who helped organize a recovery event in Augusta this past April, as she said, quote, "I feel like more people need to know about it and know how to help," end quote. 14 years old. It's sad that someone as young as Kylie has to think about substance use disorder. But the reality is, this epidemic has touched way too many lives. According to the National Survey on Drug Use and Health, an estimated 1 in 10 Maine people aged 12 and older struggled with substance use disorder in the past year. 1 in 10. Some of those people may experience an overdose. And to save their lives, we've worked hard to get lethal drugs off our streets, to identify new drugs in the communities that are also lethal, and to distribute overdose reversal medication as widely as possible. In the first 6 months of this year, MDEA agents have seized more than 19 pounds of suspected fentanyl. 19 pounds. It's probably enough to kill the whole state. In addition to methamphetamine, cocaine, and imitation prescription pills. Last fall, President Biden and Chinese President Xi Jinping took steps to limit the trafficking of fentanyl into the United States. They agreed that China will tell its companies to curtail shipments to Latin America of those precursor chemicals that are used to make fentanyl. Hopefully, eventually, we'll prevent these labs from completing the manufacturing process and sending fentanyl into the United States. Alarmingly, so far this year, 17% of fentanyl overdose deaths in Maine have also included xylazine, a veterinary tranquilizer that can cause painful open wounds, ulcers, abscesses on the skin. Quite an increase from last year. And there are no known reversal medications for xylazine. Maine's not alone in dealing with this problem. In 2022, across the country, there was an almost 300% increase in xylazine found in fentanyl-related overdose deaths. 300%. Over the past year, my administration has used about $1 million in federal funds just to educate people on the dangers of xylazine and purchase and distribute nearly 83,000 xylazine test strips. If you're going to use these dangerous things, at least try to find out if xylazine is in them. There may be no known reversal medication for xylazine, but there is one for fentanyl, which we all know is naloxone. So far this year, we've used $1.25 million in federal funds to boost our distribution of naloxone, reversing more than 10,200 potentially fatal overdoses since I've taken office. Sometimes I think about my predecessor who once said, naloxone merely extends lives, it doesn't prevent death. Then I think about people like a man named John, who's in recovery now because naloxone saved his life. John said, quote, "I now have an 8-month-old son, a wonderful fiancé. I have a wonderful life today, and I want other people to be able to experience that," end quote. Recovery is possible. New life is possible. And to give more people in Maine a chance at that wonderful life, we're making naloxone as widely available as possible. And most recently, the legislature and I have enacted laws to make it available over the counter and online, and to require law enforcement officers to carry naloxone. To help further prevent fatal overdoses, we've also worked with municipal governments to expand emergency housing to keep people from sleeping on the streets, especially during cold winter months. The city of Portland has said the opening of one of those shelters has played a huge role in, quote unquote, in a decline in fatal overdoses. Imagine that, housing is a benefit. Given that shelter staff are able to identify somebody who's overdosing and administer Narcan to save their lives when they're in a shelter. In fact, January marked the first month in 2.5 years without a fatal overdose in Portland after opening a shelter. Emergency housing is one thing, but how someone's supposed to focus on recovery if they don't know where they're going to sleep tomorrow or the next night? So, we're also focusing on creating more permanent housing, especially for people with chronic substance use disorder. We're leading an unprecedented expansion of Housing First, a program that is proven and cost-effective to providing permanent housing and wraparound services to set more people on a path to lifelong recovery. Amanda Olson, former executive director of the Augusta Housing Authority, says that the Housing First program is the obvious solution in the face of Augusta's housing shortage, its lack of recovery services, and exploding rents. She said the Housing First program has renewed a spirit of hope and optimism in our housing community. I'm so glad to hear that. But Amanda made a good point about the lack of local recovery services, too. And in addition to housing, my administration's focused on expanding treatment and recovery services statewide. So earlier this year, I signed a bill to encourage superior and district courts to ensure that adult treatment and recovery courts are available everywhere in Maine, especially in rural areas. Androscoggin County has one, but many other counties do not. And I know it's hard work. It's intensive work on the part of judges and staff, probation officers, etc. And it's hard work on the person in recovery, but it's got to be done. And it is proven successful. Since 2019, we've also expanded access to Suboxone in 28 of 33 hospital emergency departments. And we're working now to expand access to the last 5. This year, I included $4 million in our supplemental budget passed by the legislature to expand medication in the county jails. This all builds on the important work being done by the Maine Department of Corrections to provide universal access to treatment, including medication for substance use disorder, peer recovery coaching, and mental health treatment services across its system. Now, I don't believe, as many people did in the past, that we can simply arrest our way out of this epidemic. Diversion from the justice system is an important tool, but we should recognize, too, that for some people, the experience with the criminal justice system has turned their lives around. One man named Brock credited his incarceration at Somerset County Jail as the beginning of his recovery from an opioid addiction. Brock now advocates for the expansion of that diversion program at other jails. Brock said, quote, "When you see somebody get clean, you really see the life come back into their soul. Everyone is worth saving, everyone. That's the biggest takeaway," he said. I agree. In addition to expanding treatment in county jails and state facilities, we've also increased the total number of treatment beds statewide by about 50%. In the last year, we've opened nearly 70 new beds in both rural and urban communities. That includes 10 beds in Bangor, 12 beds in Auburn, 6 beds in Windham, 4 beds in Presque Isle, and 34 beds in Portland. And I just heard Danielle talk about the terrible experiences of her son and her efforts to get him into treatment and detox. And we're addressing that. We cut the ribbon on 14 new beds at Milestone Recovery recently. And the center's director, Tom Doherty, said, quote, "Every day, our nurses and our counselors have to turn away about 70% of the people seeking detox services." That's Danielle's experience. This project now is going to allow us to say yes to a lot more people. I know there's a perception, reinforced over the past few decades, an accurate one, that there are only a few beds available in Maine for treatment. That has been the case in the past, but things are changing. New treatment beds are coming online every day, and I want to make sure anybody who needs help should ask for it and should get it. Here in Maine. As our keynote said earlier, Delphin Rittman, quote, "We know recovery is real and it's possible. We know people are able to recover. People do recover. They are living full, happy, healthy, productive lives. It's important for people to have hope and to reach out to get support and assistance if they're struggling, because they're not alone. There is a vibrant recovery community to embrace them and work with them." In the supplemental budget, and I see many legislators here, and thank you for your support for all of these measures, but particularly for the $5 million in the budget to launch crisis receiving centers, including one right here in Androscoggin County, as well as Kennebec, Aroostook, and Penobscot counties. These centers serve as anchors in communities for substance use disorder and mental health services. They are in addition to the 21 other recovery community centers across the state. I see the volunteers are here. With more than 800 paid and volunteer staff who served more than 14,000 people last year alone. These are the doorways to help, the doorways to recovery, the doorways to communication and community. And to support these recovery community centers, we're adding nine new recovery coaches to our options team. And we've added 3 recovery coaches and a coordinator to serve family recovery court participants in Lewiston, Augusta, and Bangor. And we've implemented recovery-friendly workplaces. What's better than a good job? Housing and a job. Certifying, those certifications of a recovery-friendly workplace, that's being used by nearly 40 businesses who employ nearly 3,000 people. There's work out there. And another 16 businesses have applied for that certification to hire 6,300 people. We know that getting and keeping a job while in recovery isn't always easy, but we're rewarding businesses that understand the unique experiences and skills of people in recovery, and that's important. In the past 2 biennial budgets, we've invested nearly $500 million in funding, federal and state, for mental health and substance use disorder services, in addition to the $30 million in this year's supplemental budget. The measures I've mentioned today are just some of the ways we're using that funding to address the opioid epidemic, according to our strategic action plan. Each of those strategies is a step on the path to a new future that we're forging together. A future where we balance accountability with a better understanding of addiction. A future with strong communities that help people, every individual, especially young people, help them cope with life's challenges without resorting to drugs or alcohol. A future with a thriving economy and endless opportunities. A healthy population and a healthy state with no demand, no need for these deadly substances in this state. That's the dream we share, and it's the direction we're headed in together. The recent decline in overdose deaths in Maine is reason to hope, but not to rest. Everyone in this room has played a crucial role in the progress we've made and in the progress that's yet to come. Today, may we all redouble our efforts to save every life, to lend our strength to people as they start, stumble, or resume their recovery, and to bring communities across Maine together to build a brighter future for us all. There are tragedies every day. There is sadness in this room and elsewhere, but there is hope. And I'm never giving up on every person who needs help to make sure we provide that help, on every child who needs mentoring and help to find direction in their lives, to find a way to say no, to find a way to make choices that are healthy and informative. I'm never giving up. Don't you give up either. Don't give up. We're making progress, and we're going to make more progress in the years to come. Thank you all so very much. Thank you. Thank you. Thank you. Oh, yeah. Okay. Thank you. Thank you very much for all you do every day. Now, I want to present a couple of awards, the Governor's Awards, to 2 individuals who are dedicated to saving lives. I'd like to ask Dr. Marcella Sorg and Danielle Farino to join me at the podium. Marcy. Marcella Sorg. Let me introduce, if you don't know her, Marcy Sorg. In addition to her current job as a research professor for the University of Maine, Dr. Marcella Sorg has served as a consulting forensic anthropologist to the Office of Chief Medical Examiner in Maine for 45 years. Our paths have crossed for decades, and I remember working with her on so many cases when I was in the AG's office and working with Henry Ryan and other medical examiners to solve cases. And now she also consults with the New Hampshire, Vermont, and Rhode Island Chief Medical Examiners, and is an associate member of the Maine State Evidence Response Team of the Maine State Police, and a member of the Maine Overdose Review Panel, and a guest member of the Maine State Opioid Clinical Advisory Committee and Maine State Opioid Coordinating Committee. Look, her resume is 45 pages long. Not going to recite it, but we rely on her all the time for her deep expertise to understand the trends in opioid overdose deaths. She's also a tireless advocate for the people behind those statistics, each of whom has their own story and their own struggle with substance use disorder. So thank you, Dr. Sorg, for your long-term commitment on behalf of the state of Maine and on behalf of the nearly 1.4 million people of the state of Maine. I thank you. And I have an award. Where is it? There. Oh, there we are. It reads, in grateful appreciation for over 45 years of serving Maine as a public health and public safety researcher and advocate. This day, July 25th, 2024. Here's a box. Thank you. It's also my privilege to present the Governor's Award to Danielle Farino of Fort Kent, whom you heard from earlier. You've heard her story, but it bears repeating. After losing her own son, Michael, in 2022 to substance use disorder, Danielle has turned her grief into action, founding the First Mile Active Recovery Center this past May. On top of running her own real estate business, Danielle has ensured that more than 120 people have received recovery services at First Mile Active Recovery so far. People who knew him described her son, Michael, as having the biggest heart and living to make others laugh, with a smile that lit up his face and a heart of gold and a willingness to help others. I kind of know where he got that from now. Thank you, Danielle, for carrying on your son's memory and for your commitment to the people of Maine. Danielle, it's a pleasure to present you with this award, which reads as follows. In grateful appreciation for her leadership in establishing the First Mile Active Recovery Center, Fort Kent, Maine, presented this day, July 25th, 2024.